Hey everybody, this is our COVID Town Hall. Welcome back to an unwelcome topic of discussion. We have an interesting group of doctors and people here to discuss what's going on in our hospital and area with COVID today. We have Drs. Andrea Branch in Pediatrics, Dr. Rahul Mugadia, Infectious Disease, Dr. Patel, Rohit Patel in Pulmonary Critical Care, and then Mrs. Michelle Ford, Infection Control. We'll have a brief discussion on hospital COVID numbers, Delta variant, vaccines, masking guidelines, vaccine clinics, critical care issues, pediatric COVID cases and complications updated, and just to name a few. In our hospital now, we had 17 patients until we discharged one this morning. We have 8 ICU COVID patients. Unfortunately, we've had to intubate our 6th COVID patient. Of those patients that are in our COVID unit, 96% or greater are unvaccinated folks. In our medical ICU, we have 13 patients, with 5 of those on vents. Unfortunately, because we have so many COVID patients that require ICU, we've had to offload some of the nurses from our medical ICU to take care of these COVID ICU patients. As of July 27, 2021, the hospitals with the highest admitted COVID-19 patients are as follows: Mobile Infirmary, UAB, Thomas Hospital, Southeast Hospital, Huntsville Hospital, Spring Hill, Providence Hospital, and DCH. I'm just going to give you a couple of places where vaccines are going to be given this weekend. There's a back-to-school health fair Saturday, July 31st from 9 a.m. to 2 o'clock. It's a planned vaccine site with incentives provided. It's at J.R. Strickland Park, 608 Martin Luther King Drive in Hobson City. And also Jacksonville is giving an incentivized vaccinations to its city employees. So full and part-time Jacksonville municipal employees will have the opportunity to receive $200 and $100 respectively if they're vaccinated against COVID-19 by the end of September. This information is documented in Anniston Star, and the money is provided by American Rescue Plan Act. So briefly, I just want to say, again, safe practices are to wear your masks, self-distance, wash your hands, wear gloves. Please, please, please be mindful of other people. Many of the patients that we're seeing now probably have Delta variant, and Dr. Mugadia will talk about that. The unvaccinated people are the ones that are getting sick. This variant is very, very potent. And again, I'll allow him to talk about that so we can be updated for that information. And we are going back to screening at the hospital entrances. The people that are visiting or visitations are the same basically. Governor Ivey hasn't said anything about that yet, but we will follow what federal rules regulate. However, please be careful. We don't want to spread this virus, this variant, to anyone in our hospital, our workers. We're already, in critical issues regarding numbers. Hospital employees, hospital staff, please, please just help us. Thank you. I'll leave this now to Dr. Patel.
Good afternoon, everybody. I didn't expect to be here after we passed out last time and said that we were not going to come back here, but I'm not surprised to be back here. As you heard from Dr. Free, and you're hearing from the news everywhere that there's a big surge now again with the COVID, and then most of them is COVID-19 non-vaccinated people. And that kind of breaks our heart because we had a terrible experience last 1 year about losing people who did not have the vaccination back last year. But right now, what we are seeing is patients who are coming to ICU are different ages are different. Actually, we have patients in 20s, 30s, 40s, and 60s. And these are all non-vaccinated people right now in ICU. And the 6 ventilator patients that Dr. Fee said are the same age. And we actually lost a 54-year-old who was a healthy gentleman a couple of days ago with COVID-19 who was not vaccinated. And what we are seeing right now is no different than what we have seen before a year ago. All our presentations are pretty much same. They come in with the same presentation for pneumonia, and they're sitting in the room for a couple of days, and suddenly they become short of breath, and we have to intubate them, and unfortunately, some of them goes on intubator and then goes multi-system organ failure, and we cannot do anything, and we can't, despite our aggressive treatment, we are not able to save them. So that is a really shame for us right now that this could have been prevented, in my opinion. And you're going to get tired of hearing from all of us about vaccination. Tell your people to vaccinate it. Half our office staff is not vaccinated. In the doctor's offices, they need to be vaccinated, in my opinion. And regardless of beliefs about vaccination, we already have seen the proof of it, that people who are not vaccinated are not in the hospital right now, or vaccinated are not in the hospital right now, and even though they do get a symptoms, they will be mild symptoms. So as a critical care doctor, it is not fair to the doctors and the nursing and the patients who are taking care of them right now, who are all vaccinated, most of them, by the way, and they have to see these people dying, which would have been preventable death. And that is the biggest message I'm going to give it to you all. And you're going to hear more from Dr. Branch and Dr. Magadi about the difference of, but I'm here to help people, but it is really breaking my heart at this time right now, because all the people would have been prevented right now, what we are seeing right now. Thank you.
Good afternoon. It's been 3 months. So last week on July 20th, can you mute your phone?
I did, but I can't hear. There's no volume.
Start over. Good afternoon. Last week on July 20th, we reported our first Delta variant strain. For purposes of HIPAA, I'm going to be using the non-binary plural pronoun they, so that I don't get phone call from Kenny Williams. So about 2 weeks ago, this individual below 50s, unvaccinated, came to us with a 9-day history of GI, mostly GI symptoms, nausea, vomiting, diarrhea. About 4 hours after exposure to a family member from out of state. She had a positive COVID-19 testing through an outpatient facility, was told typical symptomatic treatment to isolate, but she got progressively worse, so she presented to our ER, worsening, now this time with respiratory symptoms, short of breath, a little bit dehydrated from GI symptoms. 2 negative COVID testings were done, both the Sophia, which is the antigen testing, and the PCR. But she had a classic chest X-ray findings. We sent out a COVID testing for genomic sequencing to a specialty lab in Tennessee, and within 48 hours, we were notified that the specimen was positive for the Delta strain, which is B1617.2. Anyway, she, they got, they had been in the COVID ward the whole time anyway, so there was minimal exposure to the staff. So that really tells us that it's here. We don't have the capability of doing sequencing on our PCR testing, although the PCR test that we have should be able to pick up the Delta variant strain, because they have the same platform anyway. It picks up the glycoprotein, the spike glycoprotein. That particular patient is a little bit one-off. I still struggling to explain. I think I might have an explanation for their negative testing. They have some kind of immune deficiency, and they have some medical issues. But anyway, to assure the people in the audience, including the healthcare workers, physician mid-levels, our PCR testings should be able to detect the variant strain. There are some instances wherein we might have to do a send out, and that's typically within, it comes back after 48, 72 hours. So it's here, the Delta strain, and now they're talking about the Delta Plus, which is a subvariant strain of Delta. They're talking about the Epsilon strain, they're talking about Lambda, and on and on. But I think the most important strain right now that the CDC, FDA, and everybody else are talking about is the Delta strain. Which brings us to why they got sick. Like I've said, they were not vaccinated. So I'm gonna kind of touch briefly on vaccine hesitation. It's still a problem in our community, in our hospital, and all throughout. It's a national problem. Part of that might be the hesitation because of the potential side effects, and we could assure you the side effects is not, it does not last long. You know, typically 48, 72 hours, and the side effects are gone. Usually injection site reaction, fevers, maybe a little myalgias or muscle pains and things like that. After 12, 48 hours, they're gone. One of the reasons up until, you know, the Delta variant strain that people are talking about is, you know, I'm healthy, I'm young, the risk of me getting COVID or getting sick from COVID is very, very low. So case in point, currently 2 of the patients that we have in-house are in their mid-20s. They have very minimal medical history, actually no medical history whatsoever. Mid-20s, a bunch of 40-year-olds. I think we have 2 80-year-olds, but most of them are below 60s. So that thinking, you know, during the pandemic in 2020, that I'm young, I'm healthy, I don't really have risk factors, I'm not old, I don't have diabetes, I take care of myself. That kind of is out of the window now. It's not really, it's something that, you know, you're essentially playing Russian roulette if you don't get vaccinated. So that's one of the things that a lot of people come back to me, and I'm okay, I don't really have to get vaccinated. Wrong. I'm gonna briefly touch on the myths on the vaccine. I talked about this some time ago, I think maybe October, November, when we started talking about the vaccine. One of the myths that, you know, people talk about is the mRNA vaccine. So since it's the mRNA, it's gonna alter my DNA, right? Because RNA, DNA, it's completely flat out wrong, because the mRNA technology, it actually translates in, does its thing in the part of the cell called cytoplasm. So we have kind of several parts of the cell. One is the cytoplasm. The DNA, your DNA, our DNA is in the nucleus. So the cytoplasm is kind of below or around it. So there's nothing touching the RNA with the mRNA. Also, we don't have that specific enzyme that will transform the RNA to DNA. We just don't have it as humans. So that, you know, that myth that, you know, it's gonna mess up with my RNA, completely wrong. There's also a question of aborted fetus used in the vaccine. Also wrong. There's no aborted fetus on the vaccines. One of the things that they talk about is, you know, why was this vaccine approved or given EUA very quick, very fast? And it's true. Before the COVID vaccine, the fastest vaccine that was approved by FDA was the Zika and the mumps. You know, it took them about 4 years. But the reason why we got it really approved really quick or given EUA really fast was because of that program called Operation Warp Speed. But the technology that they used, they kind of borrowed the same technology, that existing technology from SARS, the original SARS, and MERS. You know, MERS is Middle Eastern Respiratory Syndrome, which those 2 infections kind of slowly went away. They just kind of disappeared. But the technology that we used to create the vaccine for those 2 infections were there. So we used those technologies to use that. And also the phase 1, phase 2, phase 3, phase 4 clinical trials, they were done in parallel to each other. So there, you know, the FDA made sure that, you know, they had 2-month data to make sure that, you know, it's safe, and it was safe. So that myth that it's by it's given they're giving this to us without really thinking about it. We did. The next one is I'm not gonna get it because I'm planning to get pregnant. So I was told that it might cause female sterilization. Completely wrong. There is an enzyme, a protein in the uterus called syncytin-1. They said that it might be closely related to the protein in the vaccine. Completely wrong as well. There might be several chemicals that might be the same, but they're not the same whatsoever. And lastly, which is really the thing that I don't really talk about and don't answer anymore, is I'm not gonna get vaccine because it might contain microchips. It's gonna be able to track me down. That technology does not exist. So it's pure science fiction. So they're not gonna give you microchips. They're not gonna be able to track you down. I'm gonna talk about what happened yesterday. Yesterday, CDC revised their guidelines on masking. So now they're recommending that even vaccinated people, when you're indoors, need to be vaccinated. And there's 3 reasons for that. One is the Delta strain that I talked to you about earlier. They said that given that this is in some states the predominant, close to 90%, the predominant strain, which is much more transmissible. You might not necessarily get sick to the point that you need to be hospitalized, but you could get sick, mild to moderate disease. So that's one of the reasons why the CDC reversed its guidelines on masking. The second reason is the low vaccination rate. Overall, as a nation, we're close to like 48, 49, not even 50%. And the magic number for herd immunity is 80, 90%. I don't think we're going to get to 80, let alone 90%, because the vaccine, the anti-vaxxer, those holdouts, they're about 15, 20% of them. But there's still about 30% that we could capture. We could, they're not completely anti-vaccination. They just have questions, and we're going to reach out to them and things like that. And the third reason is CDC has seen a significant increase in hospitalization recently, the past 3 to 4 weeks. So those are the 3 reasons why CDC reversed its guidelines for masking yesterday. And lastly, somebody asked me, one of the physicians asked me about outpatient treatment for COVID. Nothing really new. I look at the NIH guidelines, and the guideline was from 2 weeks ago. It's the same thing, symptomatic treatment. If they have fevers, give them antipyretics, Tylenol or acetaminophen. If they're throwing up, give them something for nausea. If they're coughing, mostly dry cough, give them cough suppressants and things like that. The second one that they really want to people to realize for outpatient is to reduce the risk. So the guidelines for isolating them, the 10, 14 days, it still holds true. So it has not changed. You have to tell them you cannot go to work, you cannot go to school, make sure that you're isolated at home. It's the same thing. And lastly, and I said, your office should have a way of making sure that they have a way of reaching out to the doctor, either by telehealth for kind of mild to moderate, and those people who might be needing more care to have in-person consultation, whether through your office or emergency room, things like that. And the treatment really is, like I've said, symptomatic, but several months ago, FDA approved monoclonal antibodies. We had 2. One is called bamlanivimab, or we call it BAM-BAM. FDA actually kind of stopped recommending it because they found out that it's not as effective on Delta variant strain. So there's a second one called casirivimab, which is the Regeneron product. And we do have that available. And one of the physicians asked me how to go about that. So there's a number that you could call. It's 256-741-7464. Bridget McGurk from Occupational Health is under that infusion clinic. They prefer that you email their patient information, including demographics, date of birth, medication, medication, medical history to write this down. Capital P as in Peter, capital P, PPHANEUF at rmccares.org. Again, PPHANEUF at rmccares.org. The first P, the first two P's are capital. So that's a much more efficient process for them. It's the same criteria. So if they have been diagnosed within the last 3 days, their symptoms are within 10 days, they have risk factors 65 and above, diabetes and all those things, obesity, the same criteria, same guidelines. And lastly, what do you do? Those patients kind of doing okay at home. How do you decide whether they need more care, especially inpatient care? There's not much guidelines on that. What we do though in the hospital setting is we have them walk around. This is for patients who need to be discharged. So if they, after walking them around for about 10 minutes, we check their pulse ox and heart rate. If their pulse ox drop 4 percentage points and their heart rate goes up more than 15 points, they're not ready to go home. So we tell the nurse, they need to stay here, because what's happening is they could, pass out at home. So those are the things that we do in-house. So you might be able to do that in an outpatient setting. So if you have the patient walk around the house for about 10 minutes, you do a baseline heart rate, baseline pulse ox, and depending on their pulse ox, if their pulse is 94%, after walking around, it dropped down to 90, and their heart rate jacks up, they might need further care, including emergency room visit. And I know that's a lot information. The next speaker is a new to us. Candy Williams actually moved on to better things. She's moved up to a senior level position at the hospital administration. She's still helping us out, especially with the vaccine. We now have Michelle Ford, who used to work for us in infection control, and Michelle Ford will be talking about vaccine clinics and all those things. Thank you.
Good afternoon. I want to talk to you about the vaccine clinics. We currently are providing the Pfizer vaccine for ages 12 and up every Friday on the 4th floor of the Tyler Center from 8 a.m. to 10 a.m. No appointment is necessary. If Friday is not a good day for you, there is a website that you can go to. It's vaccines.gov, which is accessible on your Chrome. It's very simple to use. You simply enter your zip code, and then the site will provide locations of available vaccines and what type that they have at each facility. Talking about some visiting at the hospital, as we continue to see a rise in our COVID admissions, we would like to stress the need for social distancing and continued mask wearing while you visit our campus. Our current visitor policy states that each patient is allowed 2 visitors during normal visiting hours, and 1 visitor may spend the night with a patient. Please remember, these limitations are designed to protect you and your family members. If you are symptomatic and feel as if you need to be tested, you can contact the Mediplex in Oxford. They provide testing Monday through Friday from 8:30 until 3:30. The number to call to arrange a COVID test at the Mediplex is 256-235-5600. When you call this number, you will need to leave a message. Please leave your name, a phone number where they can contact you back, and please let them know that you are calling to arrange a COVID test. Someone will call you back. When they do, they will set up a specific time and give you all of the details that you'll need to complete this. And I will pass it on to Dr. Branch now. All right.
Make sure to speak loud. Good afternoon. My name is Dr. Andrea Branch, and I am a pediatrician at Pediatric Clinic here in Anniston, as well as the current department chair of pediatrics here at RMC. So this is my first time attending the town hall, and I'm glad to be here, but also a little anxious about being here because the reason I'm being invited this time is because kids are potentially going to play a little bit of a larger role this surge. So my sources today include the Children's Hospital Association, the CDC, the ADPH, and the American Academy of Pediatrics. Now, the last year and a half of the pandemic has seen children actually do fairly well in comparison to adults. They've contracted COVID at a lower rate than adults and resulted in asymptomatic to milder infections and lesser deaths than adults. But that's not been without its complications, including missed school and missed work, some hospitalizations, some children contracting long COVID symptoms, and multi-system inflammatory syndrome in children. So as of July 22nd, according to the Children COVID in State report, which was gathered by the Children's Hospital Association, as well as the American Academy of Pediatrics, about 4 million children in the United States have contracted COVID so far, with about 55,000 of those positives coming from Alabama. Now, about 2% of all child COVID positive cases have resulted in hospitalizations, with at least half of those children having an underlying issue such as obesity or chronic lung disease or prematurity. Now, of hospital admissions among the 12 to 17-year-old age group, and one study showed that 1 of 3 hospital admissions were admitted to the ICU, and 5% of those required ventilation. 0.03% of all pediatric COVID cases have resulted in death, and that totals to about 300 to 600 persons nationally, depending on which data you're using. The cumulative number for Alabama being 8 as of 7/22. Now, bringing it a little bit more local, the Children's Hospital of Alabama, the last dashboard that I got to see from them was from 7/15. From the start of the pandemic, they've admitted 500 plus patients with COVID and about 94 cases of the multi-system inflammatory syndrome. Now, to cast a brighter light as to how the whole year has gone, a poll of the pediatricians and the RMC Pediatric Department and who serve the Anniston and surrounding areas report that while there have been COVID positive cases in the clinics, none of our patients, to our knowledge, have had severe illness requiring more than symptomatic care on an outpatient basis. However, that does not include children that may have come through RMC's doors, ER doors, or Gadsden ER doors and were transferred from the ER to Children's. So where are we today? Given that those previous numbers sound fairly decent, why am I here? Why am I here to talk about this? And so 2 things is, one is, though those numbers sound decent, if your child, if your grandchild, if your niece or nephew are that 0.03% that passes away, is not a small number. You know, if your niece or your nephew or your child or your grandchild are that 2% that have to be hospitalized, and they're now missing school, and you're now missing work, and you're also on edge about, will my child develop MIS-C after all of this is over, it's not a small number, especially when it's something that could be preventable. So we are worried, just given, and I won't say necessarily worried, but vigilant, that the cases may increase this time around. Children in general, as we said, haven't picked up with the previous variants as much of the disease, and they don't seem to be the super spreaders in this with previous variants. Delta variant being more transmissible just by numbers means that you will have more children that pick it up, and if that are more children, that means the percentage of the children that are sicker will go up as well. And so again, as Dr. Magadi has said, it's one of those things of, yes, your child may get it, and the numbers say right now, and I emphasize right now, that they will do very well. But if they are of the small percentage who does not, then what? You know, so we're watching for that. In the event of a pediatric surge, right now, we still recommend you start with your pediatric office, your primary care physician, and they should be able to help evaluate whether your child is one who needs to go to the ER or to the Children's Hospital, which at this point is where we're recommending that those severe cases go. Let's see, as to actual pediatric hospitalizations, they had gone down previously and actually have been replaced with things like RSV showing up in the summer instead of at Christmas time when we're normally used to seeing it. However, in the month of July, those numbers have started to increase among both adults and children as to those who are hospitalized. So a little over a week ago, Alabama hospitals had 9 children admitted. Now the number is up to 32, which is about equivalent to where we were in the middle of the winter surge. The concern is that between the Delta variant and its higher transmissibility, as well as the longer that it's out there circulating, it could risk mutation. Low community vaccination rates and relaxed mask mandates that unvaccinated children will become the perfect vector for COVID-19 infection. Thus far, children have been largely spared, but with these new issues at play, we can't predict and say that that will remain so. So being pediatricians, a large part of our job is prevention. You know, we try to remind you to have your children wear their seatbelts in the event of that car accident. Wear your helmet if you're riding that bike to try to prevent that head injury from the fall. And so in large part, making these recommendations of social distancing, washing hands, wearing masks, vaccinating is prevention. No, we don't have a huge, issue right now for peds. As I keep saying, we've been spared from that, but we don't have a crystal ball to say that the next variant won't be the one that now places your kids at the top of, the meat chain here where COVID's getting them. So to talk about vaccines a little bit in kids, the AAP has recommended vaccinating all eligible children 12 and up, as has the CDC. And so right now, the Pfizer vaccine is the only emergency approved vaccine for persons ages 12 to 15. I know I've gotten a lot of questions about the vaccine as to safety and how they tested it, and I'm sure other pediatricians have as well. So I reviewed on the FDA, which this is something that everybody can go on their website and see how the trials were run. But the trial included about 2,200 participants, 12 to 15. Half of them received the vaccine, the other half received placebo. More than half were followed for safety for 2 months following the second dose. Effectiveness to decide if it was working, they looked at 2 things, was their immune system response to the vaccine, as well as the number of patients that developed COVID post. And so immune response to vaccine in 190 participants of 12 to 15 were compared to 170 participants aged 16 to 25. And their immune response in that younger age group was just as good as those in the older age group. Also looking at the new COVID cases that appeared in the 12 to 15-year-old group 7 days after the second dose. So no COVID cases were noted in about 1,000 vaccine recipients, and 16 cases occurred among 978 of the placebo recipients. So both of those standards that they use to say, well, is it effective, is it working, pointed in the favor of the vaccine being effective. As for younger children, the vaccine approval is still in the works. I just saw an article the other day where they're asking to actually add more participants to the trial to make sure that that it's safe for that younger age group of the 6 months to 12-year-olds. Right now, there's not a date as to when it will be available. They projected September, but if they're adding more participants, it may be longer. As to side effects with the vaccines, the standard side effects that have been noted in adults are the same thing that we are seeing in the young adults and those children, which would be fever, sore arm, a big one, headache, a little bit of fatigue. Now, that can happen with the first vaccine, but most of them we've been having the complaint happen with the second vaccine. And then the other thing that's come up is inflammation of the heart, or myocarditis or pericarditis. So there were about 1,200 cases out of 300 million mRNA vaccine that were given. It tends to happen more frequently in young men, It is still considered to be rare, and they typically recover. And so right now it hasn't been named as causal from the vaccine, but likely related to the vaccine, but that's still being worked out. However, despite that, we know that COVID in some instances and cases can cause myocarditis and pericarditis on its own, and that the vaccine still is being recommended as being the safer option of getting that versus getting COVID itself. So the last thing I wanted to touch on again was mentioned earlier was the CDC recommendation for masking. Now the AAP recommended about a week ago that all persons 2 and older, vaccinated and unvaccinated, wear a mask in schools, and this is now being reinforced by the CDC. And so that's where we are. Right now, the RMC Pediatric Department knows that there are a lot of changes going on, as it has been for this whole pandemic. So we recommend touching base with your primary care physician for any concerns or questions as these things come up and change. Thank you.
Excellent. Very good.
Thank you.
Can you come up for question and answer?
Guys, that was excellent. And excellent information on the pediatric population. This is something that we really have to pay attention to. It's not that we've been ignoring this, it's just that, as a hospital association with COVID, we admitted and took care of, the older adults. So, excellent information. If you want to reach out to Dr. Branch, I'm sure she'll be available to discuss all kinds of issues and questions. We will be having a question and answer session here in a few seconds. So there was a clinical COVID-19 panel discussion recently with the Alabama Health Association that partnered with the Medical Association of the state of Alabama. They coordinated to record a panel discussion between physicians and their thoughts on COVID-19. You could actually go to this through the YouTube, and it's u2.b/A K194 low Q U low N TQQ. And if you have any questions, we can get this information to you. But this has an excellent panel discussion on questions that physicians have come together to discuss. So now we're going to have a question and answer session.
We have one question from Dana Gray. This could be for you or Dr. Magadia. The question is, should you have the vaccine if you still have the long-acting protein from having COVID?
The what? The long-acting? Can you repeat it?
Should you have the vaccine if you still have long-acting protein from having COVID already?
Yeah, so the long-haul COVID symptoms, which they think might be the reason why they have, which partly might be blamed for those symptoms, might be related to the long protein. So one of the things that they talk about is maybe you have ongoing inflammation. So the vaccine might help with that. We have had actually, personally, I've had several patients of mine who had long COVID, and I advised them to get COVID vaccination, and the long COVID symptoms, or majority of the long COVID symptoms, went away. So yes, please to get. So there's only 2 scenarios wherein you cannot get vaccinated. Well, number one, if you are allergic to the components, specifically the polyethylene glycol, for both the mRNA and the Pfizer. Not a lot of people are allergic to polyethylene glycol. And number 2, if you have had a condition, a rare neurologic condition called GBS, which is Guillain-Barré syndrome, which typically you would see after the flu shot. So if you have had history of GBS, vaccination might not be for you unless we get more information. So those are the 2 scenarios that I could think of that you might get a pass from us not getting vaccinated. But other than that, even the governor said that it's by time to blame the unvaccinated for this pandemic. So we call it the PUF, the pandemic of unvaccinated folks.
We've had a lot of comments and questions about medical professionals getting vaccinated and people in the medical field that may be sharing misinformation or their own personal opinions. How do you combat that, and how do you encourage those people to decide on their own what's best?
So what we have done here at the RMC, and I cannot really speak for a lot of physicians. We cannot really control, but what we could control locally, especially in the hospital, and we did this to kind of set an example and to set a message that our physician lounge, as of August the 2nd, which is this coming Monday, will only be will ban the unvaccinated, basically. So that physician lounge will only be for vaccinated folks. I know it's a little bit hard to police that, but I think our IT department will be helping us out. We have the central list of vaccinateds, and we will compare that against the unvaccinated. So hopefully we should be able to at least send a message. It's hard to police because somebody could grab somebody to swap their badge, but locally that's what we're doing. Those physicians who might have some other underlying agenda to promote anti-vaccination issues, and I can't really speak for them. I know some of them might be telling people to take this medicine, and then if you look at their website, they're selling those pills and things like that. We cannot control that in the hospital, but what we could control, the physicians here in the hospital, and it's coming up. When we first started, it's about 40-50% vaccinated. We're I think about 75% now of the medical staff. That includes the mid-levels, the PAs and CRNAs and CRNPs. Of the physicians, MDs and DOs, we're close to about 88-90%. So the reason why we're kind of 75% are the mid-levels, but we're working on it. Then again, the message is, if you hear something, trust the science. There's about 6-7 months behind it. I was one of the first ones who got the Moderna vaccine in Calhoun County. I did good, safe. I haven't had the COVID yet, but I think with you personally, you can look up referable and refutable website, including CDC.gov, to check all those information. But I can't really do anything about those physicians.
One more question. Someone asked if you can test your immunity. I assume they may be asking about antibodies. And if you have antibodies, should you still be getting the vaccine?
So that's an excellent question. The commercially available antibody testings right now, they are doing qualitative testing. Recently, they're doing quantitative testing. The qualitative testing is they tell you, yeah, you're immune. They give you a yes or no answer. The qualitative testing gives you a specific cutoff. There's a number that they give you, and I think the cutoff is 300. The problem with serologic testing or antibody testing for COVID, they are not standardized. CDC, FDA, they have not come up with the actual number by which you could say it's not like a Hep B surface antibody titer that based on this titer you're immune for life or things like that. Right now there are commercially available. I could not think of any scenario wherein you would want to do an antibody testing other than if you have $50. You're just wasting your money. The other scenario by which you could do the antibody testing is if you're involved in some kind of clinical trial for epidemiology. So you're doing a zero survey. But other than that, it's the antibody testing is not standardized, so you don't know what numbers and what the cutoff. And number two, the neutralizing antibodies specifically for spike protein. So there's different neutralizing antibodies, or IgG, IgM. So we don't really know what it means. So the bottom line is, if you're eligible for vaccination and you haven't been vaccinated yet, and it's been more than 90 days after you got COVID, please do get vaccinated. This pandemic, this is, I think, the fourth wave now, first surge, is mostly due to unvaccinated. Case in point, our admitted patients now, 17 of them, only one had been vaccinated. All 16 of them have been unvaccinated.
One more question. This could be for anyone, you, Dr. Branch, Michelle. How's the hospital working with school districts in the area as school begins to start? Are you providing recommendations? I'll repeat that when you get up. How's the hospital working with school districts in the area as school starts, and are you providing recommendations?
So actually, we'll be meeting with them at some point this week to discuss that and the new recommendations that are out. By and large, right now by state governance, the schools are allowed to make those recommendations, or those mandates, I should say, on their own. So each school can make that, which, you know, as pediatricians, we can definitely give our opinion and we can make our recommendations. I would also say that parents have a power to do that as well, you know, and your voice is probably going to be bigger than ours because, you know, for some of those schools, of course, you're paying the tuition, you're on the school boards, you're going to the parent meetings, and you have a large say in what they're going to do for your child. So as of right now, we again go back to your pediatrician. A lot of times with the AAP, for instance, Alabama AAP has written a letter for schools making the recommendation again that they think that children should mask and they think that those that are eligible should vaccinate.
All right.
So people, here we go again. We're gonna have to be vigilant. Let's all pay attention, be mindful of our folks. Remember that even though we are vaccinated, those of us that are, you can still have an asymptomatic carriage, possibly. We don't know all of the answers with this virus, and this virus is very, very smart. We have to be smarter. We have to be more careful. Again, wear your mask, self-distance, wash your hands, social distance, stay vigilant, get vaccinated if possible. Start reading more about what's going on in this community because COVID is not over. And as the surges continue, you know, we thought with July 4th passing, and it's already the end of July, that the numbers would get less. It's not. And with school opening here soon, we will probably see another surge, not with just the children, but with the adults around the children and the adults with the children. So let's, you know, get it together, guys, and take care of each other. Thank you.